Hello, my name is Katie Hannant. I'm a paediatric nurse from Frimley, and today is a really short webinar on the brilliant basics that we call them in asthma care. And the first one we're going to look at is actually the blue inhaler and what that blue inhaler does, and just information you might not know about your blue inhaler that is really crucial for your asthma management or your child's asthma management. So when we talk about the blue inhaler, we talk about it as a reliever inhaler. It's got other names. It's got salbutamol, some people call it, or Ventolin, and some people call it that the clinical name is the short-acting beta antagonist. And this inhaler doesn't do anything for the cause of asthma. It only works on the symptoms of asthma. So when you've got a tight chest, if you've got shortness of breath, all of those symptoms that we see with asthma, the blue inhaler, all that it does is it relaxes the muscles around the airways in the lungs. So it doesn't actually change anything inside the airways. It just relaxes the muscles. So it works really, really quickly, but it only lasts for 4 hours. So when we're talking about the blue inhaler, we know that the overuse of the blue inhaler is really bad for asthma care for children. So if they need it, then they definitely need it and give it to them. But what we really want to get over that point in asthma care is that overuse of the blue inhaler is usually shows that a child has not very good control of their asthma. So they're kind of like, it's one of our red flags that we look for clinically when we're looking at how well children's asthma is controlled. So we know that if you've got a blue inhaler like this, then you should only need 2 of these blue inhalers throughout a year's period. So every blue inhaler should last your child at least 6 months. And we know that sometimes with children, you might have one at school, and younger children in primary care, they might have these blue inhalers dotted around. So it's really important to keep an eye on how much your child is using that blue inhaler. So this is why we say 2 is a magic number, kind of like in the use of the blue inhaler. We only want your child to have 2 blue inhalers a year. We also only want your child to have, if your child is needing the blue inhaler more than 2 times a week, then that's another red flag to us to say, actually, their asthma isn't well controlled. So we want to find out why they are using that blue inhaler more than twice a week. And that might be because they've got a cough or a cold, or it might be that they're using it before they do exercise. Ideally, the blue inhaler, the reliever inhaler, should only be used to treat symptoms, and hopefully, if your asthma is well controlled, you shouldn't need to use it more than twice a week. If you're using the blue inhaler and you're following your asthma action plan, if you've got any asthma symptoms, we say give 2 puffs of the blue inhaler and then wait a little while and see if your symptoms actually decrease. So if your child's symptoms decrease after having those 2 puffs, then brilliant. If they need any more, then please follow their asthma action plan. And our 2 big asks really is that you make sure that your child has an asthma action plan, and that you're aware of what to do when their asthma starts getting worse. And also, if your child has asthma, they need to have an annual asthma review. So they need to go and see their GP or their asthma nurse to get an asthma action plan and to go through all of the inhalers they're on and what they do, and really to get some really good asthma education. If you want any more information, you can get information on Healthier Together. If you search asthma Frimley Healthier Together, and the QR code here will take you straight to that link. But there's a wealth of information, more information on what to do and how to control, what you can do to really control your asthma or your child's asthma. And thanks for listening. And that was a really short webinar, and we'll be doing more in the series on different inhalers and also different basic asthma care that we really want to get across. So thanks for listening.